Hello students, welcome to another video lecture of Upskilling Commerce series. Today we will be discussing employee state insurance, which is also known as ESI. Learning about ESI is essential because it helps individuals understand the purpose behind the ESI deductions in their salary and the range of benefits they are entitled to, such as medical care, maternity leave, sickness allowance, and accident compensation. Awareness of ESI ensures employees can make full use of these benefits when needed, while also preventing any misuse or non-compliance by employers. For students and young professionals, this knowledge prepares them for the workplace, especially in industries where ESI is applicable, and equips them with an understanding of labor laws, financial security measures, and social welfare systems. Ultimately, it promotes legal literacy, safeguards workers' rights, and builds a sense of social responsibility towards ensuring health and income protection for the workforce. Now let's understand about what is ESI. So the ESI scheme is a self-financing social security program in which both the employer and the employee contribute a fixed percentage of the employee's wages towards a common fund. This fund is then used to provide a range of benefits including medical care, sickness allowance, maternity benefits, disablement benefits, dependents benefits, and also funeral expenses. The scheme aims to protect employees and their families from financial hardship arising due to sickness, maternity, employment injury, or even death. The government has established a statutory body named as the Employees State Insurance Corporation, which is popularly known as ESIC, under the Employees State Insurance Act 1948 to provide comprehensive social security and health insurance to workers in India. It functions under the Ministry of Labour and Employment, Government of India, and is responsible for administering the Employees State Insurance Scheme across the country. ESI coverage is applicable to factories and other establishments like shops, hotels, restaurants, cinemas, road transport undertakings, educational institutions, and medical institutions that employ a minimum number of 10 workers for most of the states, and for some states the minimum requirement is 20 workers. It is mandatory for employees earning up to rupees 21,000 per month and rupees 25,000 for person with disabilities. The employer registers eligible employees on the ESIC portal by entering their personal details, family information, and photographs. Each insured person gets an ESI insurance number and a Pehchan card, which can be used to avail medical and other benefits anywhere in India. Registration is generally done at the time of joining the job. If the employee's wages are within the ESI limit, with a wide network of ESI hospitals, dispensaries, and branch offices across India, the ESIC ensures that insured persons and their dependents receive cash and medical benefits without delay. Over the years, ESIC has modernized its operations by introducing online registration, e-Pehchan cards, and digital claim processing, making the scheme more transparent and accessible. In essence, ESIC plays a vital role in protecting the health, livelihood, and dignity of India's workforce, making it an integral part of the country's labor welfare framework. Now let's discuss about the applicability of ESI scheme in brief. The Employees State Insurance Scheme, as defined under the Employees State Insurance Act 1948, applies to certain establishments and employees based on location, nature of business, number of employees, and wage limits, with the government periodically revising its scope to expand coverage. It covers non-seasonal factories with 10 or more employees using power, as well as shops, commercial establishments, hotels, restaurants, cinemas, transport undertakings, educational institutions, medical facilities, and other establishments notified from time to time. In most states, the threshold is 10 or more employees, while in some states and union territories, it is 20 or more. Initially implemented in selected industrial areas, the scheme now spans almost all districts of India, with new regions added through notifications. Employees earning up to rupees 21,000 per month and rupees 25,000 per month for persons with disabilities are mandatorily covered, and coverage continues until the end of the contribution period even if wages exceed the limit. Registration under ESIC is compulsory for eligible establishments, and both employer and employee contributions are statutory requirements. Seasonal factories operating for less than 7 months a year and establishments providing superior benefits may be exempt. Once registered, employers must enroll all eligible employees who receive an ESI Pehchan card granting access to ESI medical facilities across India, ensuring continued coverage as long as eligibility conditions are met regardless of job changes within covered establishments. Now let's discuss about ESI contributions. Under the Employees State Insurance Scheme, contributions are made jointly by the employer and the employee as a fixed percentage of the employee's wages, creating a self-financing fund for medical and cash benefits. As per the current rates effective from 1st July 2019, the employer contributes 3.25% of wages while the employee contributes 0.75%, making a total of 4% each month. For ESI purposes, wages include basic pay, DNS allowances, house rent allowances, overtime, and other cash allowances, but it excludes items like employer PF contributions and gratuity. Employees earning a daily average wage of up to rupees 176 are exempt from paying their share, though the employer's contribution remains payable. Contributions are made for defined periods like April to September and October to March, with benefits available in the corresponding benefit periods. Employers must deposit contributions within 15 days of the month's end to avoid interest and penalties, ensuring uninterrupted access to ESI benefits such as healthcare, sickness allowance, maternity benefits, and accident coverage. The Employees State Insurance Scheme gives health and financial support to workers and their families when they face sickness, maternity, injury, or death. Let's discuss the benefits of ESI in detail. The first is medical benefit. Free medical treatment for the employee and family from day one of joining ESI includes doctor visits, hospital care, surgeries, medicines, and follow-up care. Even after retirement or disability, you can still get medical care by paying a small fee. Next is sickness benefit. If you fall sick and can't work, you get 70% of your wages for up to 91 days in a year if you have paid the required contributions. For serious long-term diseases, you can get 80% of wages for up to 124 days. Next is maternity benefit. Women employees get 100% of their wages for up to 26 weeks, and it can also extend by one more month if needed during pregnancy, miscarriage, or adoption. Next is injury or disability benefit. If you are injured at work, you get 90% of your wages during your recovery. If the disability is permanent, you get a lifelong pension depending on how much your earning capacity is affected. The next are dependents benefits. If a worker dies due to a work-related injury or disease, their family gets a monthly pension equal to 90% of the wages. In conclusion, the Employees State Insurance Scheme is a crucial social security initiative by the Government of India designed to safeguard the health and financial stability of low and middle income workers. By providing comprehensive medical care, income protection during sickness, maternity, disability, and other contingencies, ESIC ensures that employees and their families are protected against unforeseen hardships. Its mandatory nature for eligible establishments promotes fair labor practices, while its wide network of hospitals and dispensaries ensures access to quality healthcare across the country. Understanding ESIC is essential not only for compliance but also for appreciating its role in promoting worker welfare and social equity in India. So that's all. in the topic of employee state insurance. We will meet in another video of Upskilling Commerce with a new topic. Till the time, thank you.